The next topic in developmental disturbances of jaws is MICROGNATHIA. Hi, welcome to DentoRise. MICROGNATHIA implies small jaws. Micro means small and gnathia means jaws. Both the mandible and the maxilla can be affected because of this pathology. Now, the small size of the jaws can be attributed to two reasons. The first reason is the jaw may actually be very small. The other reason is the jaw may be of the correct size, but because of the abnormal position or abnormal of either the maxilla or the mandible with respect to each other or with respect to the skull, the jaw may create an illusion that it is small in size, but actual size is absolutely normal. Now, there is one more factor onto which micrognathia can be classified, whether the small size of the jaws is of prenatal origin or postnatal origin. If micrognathia appears prenatally, then it is called as congenital micrognathia. If it appears postnatally, then it is called as acquired micrognathia. Talking first about the congenital micrognathia, again it is of prenatal origin. This can be because of some abnormality. It can be because of congenital heart disease, Pierre-Robin syndrome, etc. There are many disorders. Other than that, during the development, if the jaw growth is normal in size, but the position of the jaw is impaired with respect to the skull or with respect to the opposite jaw, as we have already discussed, then also there can be illusion of micrognathia. Let's take an example of the mandible. For example, if the mandible is small in size, but if the mandible during development gets posteriorly positioned, then it will definitely give an impression of small mandible. It will manifest itself in the form of steep mandibular angle. There will be severe protrusion of the chin, and the deficient chin button can also be seen in such cases. Again, repeating, in these cases the mandible is normal in size, but because of the position of the mandible with respect to the skull, mandible will appear to be small. We can also take an example of the maxilla, wherein because of the maldevelopment of nasal and nasopharyngeal structures prenatally, there can be deficiency in the premaxillary area, therefore leading to the micrognathia of the maxilla. This was all about the congenital micrognathia. Coming to the acquired micrognathia. Acquired micrognathia appears postnatally, that means after the birth. If there is any trauma or infection of the temporomandibular joint area or the mastoid area or the middle ear, there will obviously be ankylosis of the joint. This ankylosis of the joint will affect the mandibular growth, that means the mandibular growth will be deficient, therefore leading to micrognathia of the mandible. This is one example of acquired micrognathia. So in this way we can memorize micrognathia. In this way we can present our answers in the exams as well. This is easy to memorize, this is easy to present, and most importantly easy to understand as well. Hope the video was helpful for you. Please like, share and subscribe to our channel. Stay tuned for our upcoming videos.